The Nigerian government is responding to concerns over a $1.9 billion funding gap following the planned withdrawal of the U.S. support from the health sector. Our correspondent reports on how the Health Ministry plans to fill the shortfall while modernizing services and expanding coverage. Folashade Abdusalami has more details in this report.
The Minister of State for Health and Social Welfare, Dr. Ishaq Salako, said the government had already begun adjusting plans to cover gaps in public health programs, ensuring that essential services continue for children and vulnerable populations. He confirmed that discussions with international partners, including the US, are ongoing to ensure gradual transition that avoids disruptions to critical health initiatives. The minister explained that as the U.S. support winds down, other partners and domestic efforts will step up, focusing on sustaining programs and meeting local health needs over the next 5 years. He also stated that the ministry is increasing domestic funding for healthcare, saying plans are on the way with the National Assembly to raise the health budget for children from 1% to 20%.
Before the withdrawal of the US was announced, the government of Nigeria moved very quickly to close the gap by providing additional 200 million USD to cover some of the gaps that we have envisaged. Now that that has happened, you must also know that the US government is in discussion with the Nigerian government. In fact, have signed an MOU of partnership of how to cooperate and partner with one another and gradually reduce the level of involvement of the U.S. government in supporting public health programs in the country. So as the U.S. government winds down, Nigeria will wind up and gradually close those gaps. And I think that with that kind of approach, over the next 5 years, we will ensure that no gap that is left behind will affect.
In the meantime, health experts said the funding gap should be a wake-up call for Nigeria and other African countries to rethink on how public health is financed. Corporate Accountability and Public Participation Africa (CAPA) said the deficit highlights the need to prioritize health spending and mobilize domestic resources. The agency urged for contributions from individuals, philanthropists, and institutional donors alongside structured public health taxes as measures to generate significant revenue for public health programs while also reducing consumption of harmful products.
Urgently is that Nigeria must look at the health financing through public health taxes. This is a global acceptable process to tax unhealthy consumption and use it to generate revenue. Nigeria has started taxing tobacco. They've also started taxing sugar sweetened beverages. But the problem with these taxes are that they are not enough. And when even that they are not enough, the government has not put a structure in place to earmark them. So we have this problem with tobacco control funds. We also have it with the SSB tax in Nigeria. They are minute. Recently, the World Health Organization advised countries that taxes on these products, including alcohol, tobacco, SSBs, and food products that are ultra processed with high sugar, salt, and fat content, should be taxed to up to 50% of the retail prices. This means that in the case of Nigeria, let's say SSB tax is put at about 130 naira per liter, or say 50% of SSB products. Minimally, Nigeria would earn about $790 million. $790 million naira from SSB taxes annually. This can be put back in public health. So it means that when we're looking at individual philanthropic systems to put money into public health financing.
Away from the health funding gap, the federal government highlighted improvements in primary health care delivery, noting that coverage in local health centers have increased from 10 million to 45 million in just 2 years. The Health Minister of State, Salako, further noted that digital health technology is playing a central role in this transformation, allowing for improved service delivery, monitoring of healthcare workers, and reminder for patients to keep appointments, adding that health literacy campaigns are also being prioritized, empowering Nigerians to take preventive action and reduce the burden of diseases.
Dedicated to primary health care, because we recognize the importance of that. And you see how we rolled out data, how patronage in our PHC levels has improved by over 300% in our 2 years, based on the records from about 10 million to about 45 million. That shows progressive increase, and it also demonstrates that the average Nigerian is beginning to trust what we are able to deliver at the grassroots level better.
As the world marks World Health Day, the message is clear. Without sustaining funding, universal health coverage remains a distant goal. And with the US exit creating a major funding gap, experts say urgent reforms are critical to protect healthcare services and strengthen Nigerians' health system. Folashade Abdusalami, MITV Plus News.